Welcome to Yakima Southwest Rotary, the
most awesome club in the world.
All right, I have Bob for invocation.
No need to applaud. You don't applaud ministers when they get up to preach. Let us pray.
You're special.
We give thanks for the majesty of this universe and the beauty of the planet. May we be good stewards of this earth. Guide us as we strive to serve others. Amen. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, Bob. Bob, you do such a great job with invocation. I had 3 people decline to do invocation ahead of time, so Bob just becomes the natural line of progression there. Mary Lynn for introduction of our guests here today.
Hi. So we have Aaron Black here from Downtown Rotary. Aaron, do you want to introduce? You have a guest as well?
Oh, yep, this is Lindy Coleman. She works at the Memorial Foundation. This is her very first Rotary meeting.
And then Dave Rankin has a guest.
My guest today is Nicole Medina. She's with Washington Federal Insurance, and her husband runs our manufacturing division, Alex. So, welcome, Nicole.
Welcome.
Jean DeLuca has a guest.
I have my lovely wife, Amber.
Liberty brought a guest.
This is Ken Gola. We live in Portland, and this is the first Rotary meeting.
Welcome.
And Craig Dwight has a guest. Do you?
No.
It says here Vicky Dwight's here. No?
Just in the bar.
Okay. All right. Never mind. There you go.
Thank you, Mary Lynn. All right, time for some club announcements. Let's see here. I think we got some birthdays coming up just around the corner. Dave Lemon's birthday's coming up March 1st. Mark Hummel's going to be on the 4th. Going to kind of blow through announcements today. We have the women's build. You see this in your bulletin. So to get signed up, you can use the QR code to get signed up. It's a $25 donation. So check that out. We've got a membership orientation that's coming up. We've got one for March 15th. It's from 6 to 8 p.m. This is for newer members to the club that maybe you haven't been to a fireside. So it's kind of a fireside new member orientation. We have one March 15th that's hosted by Lynn and Kathy. And then we have another one April 14th hosted by Lizzie and Tammy. So, and then on the bulletin, there's an RSVP with Tammy's email. Do you want RSVPs for that? Is that okay? Okay, we have a Rotary auction coming up. You kind of are all learning the drill on this. We're hoping to get the sign-ups for ticket sales. If you've RSVP'd a table, a sponsorship you're taken care of, we'll get you the registration information to get into the system. So you'll see that come out. But for the rest of you to get signed up for single tickets or to buy a table, that's going to go live here shortly. So we've got a meeting tomorrow morning to kind of finalize a few things. Wanted to throw this in there. Again, I never want to be a hypocrite, so I signed up this morning. So now I can share and guilt the rest of you to sign up for this. So the district conference is in Leavenworth. They have a gentleman that's going to be a speaker. He's summited like 14 summits over 18,000 feet as a special guest. They have a band. They have some good keynote speakers. They have a lot of fun on a Friday in the Kashmir Valley. So I'll send some more information about this in a link in next week's bulletin. And then I believe there's some other club announcements. Tressa, do you want to share about Guess Who's Coming to Dinner?
Yes. For those of you that are newer to the club, Guess Who's Coming to Dinner is one of our funnest events of the year. It is where you can choose to cook and host up to 8-10 people at your home, or you could just be a diner and go to someone's home. But the best part of it is you don't know who would be coming to your house or where you're going. So you get a phone call the day of to let you know the address of where you're going, and then I also communicate with the host and let them know how many people will be coming. So the sign-up sheets are on your table, March 25th. It starts at 5 p.m. this Saturday. I know that it's also the symphony that night, but it's at 7:30. 7:30. So we will eat at 5 and then go to the symphony. So anyone, otherwise, please sign up. It's super fun. It's a great way to have an intimate, more private conversation with some of your fellow Rotarians to get to know them a lot better. So,
Thank you, Tressa. Josh, you have an announcement for essay readers.
Yeah, I just wanted to actually touch base. A couple of weeks ago, I asked for essay readers, and it was an overwhelming response from our club. There was I think 16 people from our club who volunteered, and I needed 20 total and needed to spread it amongst all of the clubs. So I reached out to the first 3 or 4 people who have volunteered and said, please support us. So if I haven't reached out to you, it means you're on the alternate list at this point. So congratulations and thank you for being so generous. So there, that's all.
Thanks, Josh. Earlier this week, I sent out an email on Friday, and I'm very proud of myself because I wrote that email on a Wednesday, but I set it out to go out on Friday at 2 p.m. so you'd all get it over the weekend and wouldn't interrupt my business day with hundreds of members that were going to be so responsive and email me back this information. So anyway, long story short, over the weekend, really excited. I got a number of emails back. What some of you remember, I asked some of you for your t-shirt size, which is kind of a strange request for me to ask for your t-shirt size. So I have, for many of you that have replied, some of you have met some benchmarks. Some of you may have replied, met the benchmark, but I need to clarify something. And that one clarification is going to be for the Christmas Yakima School District kids, right? Many of you signed up for 2 and 3 kids. So you actually will get 2 or 3 points for community service instead of just 1. So I'll email those that have replied back on the community service. But I have some people that have met the minimum obligation, and I have some people that sent me the email. So if you haven't sent me the email and you've met the obligation, then you'll be up next, okay? So if I could have Dave Rankin please come up here. I have something for you. David has completed 2 community service activities sponsored by Southwest Rotary. So David has a shirt, you can kind of see, and it is a Southwest Rotary Service Superstar. That's what David is. So thank you, David. Okay, next up I have Mary Lynn Brewington, MLB. Come on up and get your shirt. Okay, so Mary Lynn, here is your Service Superstar shirt to Southwest Rotary. Thank you. Thank you. Another Southwest Rotary Service Superstar, Stephanie Kinney. Stephanie. Now, I try to get women's fit shirts, because some people like the women's cut. If you don't like the women's cut, you need a different size. I have extras, so just let me know if you want something, a different cut or a different size. We can do that for you. Tammy Granados, another Southwest Rotary Superstar. Thank you, Tammy. All right, Taylor Stormo. Taylor Stormo, if you can come up. Thank you, Taylor. Yep, we can trade it out. So thank you, guys. I appreciate it. Our club appreciates it, our community appreciates it, so it'll be great when those emails start flooding in, then you too will get a t-shirt. I didn't, yours has, you only had one community service box checked. So, you didn't email me, you texted me your bingo card. It's hard to decipher what was what, so. I'm sure, Tressa, you are a Southwest Rotary superstar. All right. And for those that don't have a bingo card, you can get one. I've got lots of others, and those that are new to the club. You'll have time to do lots of community service projects if you haven't done two yet. So you got lots of opportunity for that. So, all right, with that, I'm going to bring up Frank Rowland for Sergeant of Arms.
Thanks. All right, we've got the drawing. What do we have in the pot? All right.
So the last three are 696.
696. Looks like. Hopefully we can get back there, Liberty.
You're the winner, aren't you? Liberty is now. Oh, okay. So do you want Liberty to draw for you?
No, I'm going to draw.
We'll take all the credit. What does that say, Liberty? Okay, give me your card. Grab any card arbitrarily. All right. Oh, it's a queen, but it's a queen of clubs.
Oh. All right. Okay, do we have any happy bucks? Nobody's happy? Oh.
I'm happy. Today is my father's 80th birthday.
Wow.
Nicholas Craven. I took him some Essentia treats this morning, and he'll be just cranky as hell all day tomorrow.
All right, thanks, Ryan. Any? Taylor?
Happy because I have a 6-year-old just got his driver's license, so it's less pressure on me taking him to school, doing errands. I'm sad because it costs $300 down with my insurance each month. And then I have another happy because this money came from Bill, who lives in city. So
All right, thanks, Taylor. Any more happy bucks? Oh, I got one right here.
So, it's twofold. I want to thank Tom. I've been traveling with my daughter. My daughter is 19, and I traveled with her every year, and we did something really cool. To give you an idea, when she was 9, I took her to New York. But this year, last week, I was in France, and I asked Tom to give me some photos, and I had by far one of the best tourists ever. So.
Yeah, great. All right, Jill, did I see your hand?
I see you're wearing a Zag shirt, so I'm going to give 2 happy bucks, and Joe and I are going to Las Vegas next Monday. See you there.
Excellent, thank you. You are exempt from fines today. Okay, did I see? Oh,
A lot of you know my friends down in Jordan, and before COVID, they went down to Florida to try out the youth, and they finally got called. They passed everything down there, and now they're right in Georgia right now, and today was their first day down there, and so they're going to hopefully be on TV with family too.
oh, what neat.
Here's happy bucks for them that they made it, and one of the girls, they street shot from Seattle to Atlanta, lost her luggage.
Oh, no.
All the dresses, they have to coordinate the color coding, they have like 10 pages of rules to go on, what they have to do, they can get turned down, but it's okay there, and they, for this. When they get there, the airline got told they're on time last night at 10 o'clock, and so they went to get it, so far, and I haven't heard from them today yet. So I'm waiting to hear.
All right, well, we'll hope for them. Credit.
On the lighter side, I bought a new pair of ski boots today, and these are so comfortable, I might sleep in them. Nordica has come up with a really great idea, and it's just one buckle on the back and a strap over the front, and you're in them, and they are comfortable.
Is Sig Fossum here? Because I just heard a cut for.
To keep on the ski theme, I want to talk just briefly about the White Pass ski area. There's a new foundation that one of the owners established just recently, and it's to bring underprivileged youth to the mountain and learn to ski.
Very
And
cool.
So myself, and I don't see Bill here today, is Beaver here? We're contacted to volunteer for this program. So 4 nights in the month of March, we get to volunteer and teach underprivileged youth from the Yakima School District and the White Pass School District to ski at White Pass. And so I'm really excited by that. And also, maybe Ryan had something to do with this, and I suspect he does. It's the first time in, I think, 20 years that the Yakima School District has partnered with White Pass to do something in skiing. So I'm really excited for that opportunity.
Very cool. Very cool. All right. Any more? Any shameless plugs? All right. Let me jump into this. So, anyway, so you what is going on with this? Okay. All right. So, it's my rock star stuff that I'm used to. So you should all know that March Madness is just about to happen, and for me, I am a kook, so I don't normally get that excited about March Madness, but sometimes we've been there. But I also graduated from Gonzaga, and I wish he was here because Dick Johnson and I had this conversation a number of times about when the Cougs are playing the Zags or that kind of thing. But today I'm going to concentrate just on the Cougs and the Zags. We're going to go back and forth, and their connection to the NCAA tournament. So I'm going to start right here with a Coug football player. True or false, and this is $2, true or false, Wazoo has never been in the national championship game? For basketball. Okay, this is not poking the Cougs in the eye. What do you think? True or false? That is false. They actually have been in the national championship, and we'll get to more about that game shortly. You can save $1 if you can figure out what year they were in the national championship. 41. So it's been a couple years. All right, George, your table. What year was Gonzaga's first time in the NCAA tournament? And I'll give you some choices. 1917, 1962, 1984, you might remember a certain guy that was playing then, or 1995. A while. That's such a Coug answer. 84 you would think, but that was John Stockton's year, and they did not go. They did not go until 1995. So the dynasty is really pretty young. Okay, in the back. So, who was the coach of the WSU number 41 team? If you have any Cougs at your table, you should know this. Come on, Tressa. Take off that Husky hat and put on that Cougar hat. That was football, but not a bad answer. It's actually Jack Friel, which is what the basketball stadium is named after. So, all right, so a couple bucks there. Let's go back, way back there. All right. In what year did Gonzaga become known as a Cinderella team? I'll give you a hint. I can't go back before 1995. So I'll start at 1995, 1997, 1998, or 1999. You are correct. All right, no fine for you guys. Okay, middle table right here. All right, so the Cougs beat Arkansas 64-53 to get into the championship game in 1941. True or false? 64 points was the most scored in any game for the 1941 tournament. I'm going to warn you, there's a follow-up on this one. That is true. I figured you'd get that one. The more difficult question is, who did they play in the championship game? Florida, Wisconsin, North Carolina, or Rutgers? What's North Carolina? That's close, but it's actually Wisconsin. So just $1 for you guys. All right. We'll go right here to the Husky table, one of the Husky tables. Okay. The 1999 Cinderella team made it to the Elite Eight. This is Gonzaga, losing to UConn 67-62 after being down by 1 point with a minute left. What seed were they when they entered the tournament? There's 16, so you can, yeah. Just take a guess. You got to be somewhere. You're not coming in the number 1 seed and being a Cinderella.
How about give us 8 seed?
I can't, because this is too easy if I give it to you. It's a 10 seed. Sorry, $2. Okay, so that's a pretty big deal to make it to the Elite Eight, coming in on a 10 seed. If you watch this year, you won't see a lot of those. All right, Corday's table. How many teams were in the 1941 national championship games that the Cougs were in? How many total teams? Currently, it's 64. It hasn't always been 64. So I'll give you a little help here. 8, 16, 32, or 64? Eight. It was actually 8. Yeah. Okay. And the Cougs beat Notre Dame to get into the championship game, or to get into the Sweet 16 that year. Okay, let's go over here to my table.
Why?
How many national championship tournaments have the Zags been in since 1999? Just how many times they've been to the NCAA tournament since 1999? I can give you some hints if you'd like. Okay, it's actually every single one since 1999, so it's 23. Okay, back there. What league was WSU in 1941? You're going to have to just guess that, because no, not on that one. So. In 1941. If this was a downtown club, they'd all know it. What? I haven't heard an answer.
West Coast.
No, but you're not far off. It's the Pacific Coast Conference. Yes, so there's one I didn't know. And finally, in the back corner, what year did Gonzaga win their first regular league championship? Not NCAA tournament champion, their league championship. And I'll give you a hint. 35, 1954, 1966, and 1972. And I have a follow-up from this one. Do you want those again? You are correct. Very good. And what conference were they in? That's $3 for you. I'll give you a hint. It still exists, but they are not in it. Close is Big Sky. All right. Well, that's all I have. Thank you.
Thank you, Frank. I have, let's see, I'll just back up to it. Back to club announcements. Southwest Rotary Superstars. When I was sitting down, I realized I missed someone. So if you can give a great round of applause for Josh Munson. He is a Southwest Rotary Superstar. Thank you, Josh. Sorry to leave you hanging. All right, if I could have Josh Logston come up to introduce our speaker.
Thank you, Dirk. I get the privilege today to introduce Kelliann Egerson. Kelliann has served as the Provider Relations Liaison at MultiCare Yakima Memorial Hospital since September of 2021. Kelliann was the provider and physician recruiter for the Yakima Memorial System since January of 20 before assuming this current role. She has been employed with Memorial since 2014 and recruited at every level of her organization. Kelliann has served on the SELA School Board from 2009 to 2021 and was, Go Vikings. And the board president for 6 years, overseeing the construction of the middle school and additions to both the high school and the Robert Lintz campus. Kelliann is currently the board and chairperson for the SELA Parks and Recreation Service area. It's a role that she's had since 2012. She's proud of the new SELA Aquatic Center, which was built with bond funds from the service area and is operated by SPRSA. She's very proud of her family, including her 2 children, Elliot, which is who's an attorney here in Yakima, and Anna, who is a senior at UW. I was expecting somebody to say something. So, will you all please help me welcome Kelliann Egerson?
Thank you. Thanks. Yeah, we're a house divided, I should point out. Elliot is an Oregon Duck, so I have a duck and a husky. So I'm sorry, Cougs. I guess you can agree that you dislike both of the children's schools, and we can go from there. But it's really a pleasure to be here today. And before I get started, I want to point out we've got almost the entire Memorial Foundation in the house. And it's a credit to the Memorial Foundation that I had the opportunity to come and speak to you today, because Josh extended the invitation when he was at our first new provider meet and greet hosted by the foundation. We have our second such meet and greet tomorrow evening, and these meet and greets are the product of the women's guilds expressing interest in helping to support provider recruitment and retention in our valley. So I want to acknowledge that there might be some of you, almost certainly are some of you in the room, who have gone outside of the community in search of care over the last couple of years. We have had some departures in some key areas. Gastro comes to mind. Those of you who are in need of a colonoscopy, I know that we're keenly aware of some of the deficits that have been created over the last few years. But it's not all bad news, and so I want to talk about what we have been able to do and where we're going, of course, because we're just in the second month, I would say, post MultiCare acquisition, and so big things on the horizon. At least we hope. So let me, without further ado, and I do, please, if you have questions as we go along, stop me. I have been known to try and fit maybe 4 more words than are necessary in any one moment. So my title, I'm a Provider Relations Liaison. That's a mouthful. Suffice it to say, my role is, after having been the frontline provider and physician recruiter, I now am the person that the frontline recruiters hand candidates off to at the point where they are ready to come out for a site visit. So I coordinate those site visits, I host those site visits. Should they be offered a contract and sign the contract, then I become the person who helps to facilitate the credentialing process. And ultimately, when they join us, as we had a new ENT physician do this week, I am the one who coordinates their onboarding and welcomes them to campus and kind of make sure that they have everything they need to hit the ground running. So that's my role. Okay, But before we get into the nitty-gritty of my experience here over these last 3 and more years in provider recruitment for our now only hospital in this community, I wanted to give you a sense for the national landscape, because as we attempt to attract high-quality providers and physicians to this area, we do so as all other organizations do, coast to coast. And guess what? The physician shortage in the U.S. is on the rise. I won't be the first one to tell you that, but it's something that as a nation we'll be grappling with, probably for the rest of our collective lives. So there are more organizations, more healthcare organizations searching for physicians than ever before. And this data, by the way, comes from, I want to point out, the Association for Advancing Physician and Provider Recruitment. Their 2022 annual report, I believe it just was published, so I was able to get a copy, and so that's where this data comes from. There were 175 hospital systems across the country who responded to this survey. So that's where this data comes from. So Yakima needs more physicians, and so does every other community, coast to coast. And the percentage of searches that were filled in 2021, the year for which the data in the 2022 report came from, unfortunately, the number of searches that were successful decreased for the 4th straight year, with 47% of those physician searches still open at year's end, and 32% of the APP searches, and I'm going to stop right there because I don't like jargon. You'll hear physician. A physician is someone who's graduated with a medical degree or a doctor of osteopathic degree. So your MDs or your DOs. We are proudly home to PNWU, and maybe you've had a speaker from PNWU come before this group. So you'll be familiar that it is considered a synonymous level of education. If you're an MD or a DO, you are a physician. Separately and importantly, there are advanced practice providers, and they are not considered physicians. They are rather your nurse practitioners or your physician assistants. And so collectively, we refer to them as advanced practice providers, APPs for short. So I will occasionally use provider as a collective term, but many physicians prefer that the physician be parsed out and recognized separately from the advanced practice provider. So in case you've heard those terms and not been familiar, that's the story. So it takes slightly less long to fill the APP position, and more of those were successful, with only 32% still open at the end of 2021. It takes a long time to recruit a provider, whether it be a physician or an APP. It took a 103 days median, 195 days on average to fill the typical physician search. And again, the APP, 62 days. Nearly half of all physician searches were to replace a departing physician. We have an aging labor force in our medical community. I know that's true across a number of specialties, but certainly true amongst physicians and providers. And you've probably heard the pandemic did mean that we had some physicians choose to retire maybe earlier than they otherwise would have, which has exacerbated some of the challenges in this space. And again, the rate at which we're replacing physician departures has increased 16% greater since 2018. We're continuing to employ more APPs versus physicians. Of course, it's a shorter training cycle, and that's how it would seem, based on my 3+ years, the way that we as a country are attempting to address the physician shortage is that we're relying more and more on those advanced practice providers versus our physicians. And maybe you've heard the term locum tenens. It means in Latin placeholder, if you want to geek out like I sometimes do. But it's really important that you recognize that, much like substitute teachers, Ryan back there, I was a substitute teacher for 6 years in the Yakima district, and of course a longtime school board member. Public education is near and dear to my heart, and teachers can't just take a day off and not have the substitute teacher there. The work's too critical. Same holds true for healthcare. If the physician's going to be gone, unless it's something that can wait, we usually need to have a locum tenens physician in place. And one of the things that we've seen post-pandemic, or even during the pandemic, is the cost to have your locum tenens providers has skyrocketed. So an additional pressure on healthcare systems is that as we look to have coverage while we conduct these long searches, we're paying more and more to have those locum tenens physicians in place. So And we do have a number of locum tenens at the hospital right now. The way to source a physician, for all of the particulars that I've just discussed, physicians are employees, and guess what? They go to job boards, they go to the internet. There are physician-specific job boards, of course, but they're looking for jobs much the same way that you and I would look for a job. So internet job boards, referrals, and of course then the organization website. Those are the most common places. Questions about any of that? No, all right. I did want to include, this data comes again from the AAPPR, that physician recruitment national organization. I've broken PowerPoint 101, none of you can read that, and that's okay. I wanted to show you that this is the variety of medical professional that we recruit to and that staff our hospitals and our clinics. And the most common type of physician that we recruit for nationally, well, this will surprise no one, is family medicine. So you had, of all of the participating organization, 11% of their searches were family medicine, followed by hospital medicine. So those are your hospitalists, your physicians that take care of you when you're an inpatient. And then internal medicine, so those are your adult clinic physicians, and on down the line. So cardiology is right below there, OB, surgery, psych probably, again, won't surprise any of you. Neurology appears near the top of that list, and that's one of those areas that we are actively recruiting to at the hospital, but neurology, it's a challenge. Oh, I kind of skipped ahead there. And so here I wanted to tell you, so you've got all of these open searches, the most common family medicine, but family medicine isn't the least filled, so it's still challenging to fill family medicine, but the single most difficult was your ENT is how the short for the I always struggle to say that, but yes, so ENT, with only, you still had 63% of those searches open, the least often filled. Dermatology, urology, again, traditionally urology is really difficult to recruit to. Transplant surgery, we don't have that here in our community. But then there's neurology, right down there, number 5 on the list. And so, unfortunately, we've got our work cut out for us. But I want to point out, rheumatology appears just not too far down, and we were so fortunate to welcome a new rheumatologist to our practice there at Lakeview, Dr. Tim Riddenden, who is himself a graduate of PNWU, and it was through the PNWU experience and his love of the community that he came back after fellowship back in his home state of Minnesota. So sometimes some of the distinct advantages we have here in Yakima with our local programs mean that we can buck these trends and still manage to successfully recruit otherwise really difficult to fill positions. And I mentioned this week we welcomed Dr. Michael Mitchell. He is an ENT, and so we were able to buck that trend too. So though it was the least filled, we were successful. We're really excited to have Dr. Mitchell on staff. He's got lots of wonderful experience and has a particular passion for facial trauma, you might think. But given that we had those slick surfaces this morning, again, one fall and an inadvertent crash to the face, you're really grateful to have Dr. Mitchell around so that we've got someone who's excited for the facial trauma cases. Physician recruitment, it's a long game. It's hard. We've got a lot of openings. And again, my apologies to everyone in the room who finds that they can't access care the way that they used to in Yakima. Again, we're working on it, but we've had some successes. So I wanted to take some time to point those out. So these are the 3-year providers. 3-year provider count's kind of obscure, isn't it? This is the number of new providers that we have welcomed to the system. And I scrubbed for any per diem or PRN. We also contract a number of providers who come as they're able. They don't have a set schedule. They don't necessarily mean better access for you and I, so I took them out. So these are raw, true numbers of providers who have come to our system and newly employed. 2021, little inflated. In 2021, Memorial Hospital became the employer of record for our cardiologists. Those of you who have sought care at the Yakima Heart Center. No, they were an independent group under contract with the hospital, and then were acquired by the hospital in 2021. So those are slightly inflated because that wasn't a net increase in access to care for you or I. But you can see that 27 in 2020, 38 with the asterisks, and 22 in 2022, we are successfully attracting these highly skilled, talented professionals to our community. We are also losing some. And so again, working on retention, always, we got to keep retention in the back of our minds as we go through this. Again, breaking the rule of legibility, but this is all of the various types of providers who have been hired and welcomed into the Memorial Hospital system over the last 3 years. The two tallest CRNAs, so that's your certified registered nurse anesthetists. If you have had a procedure, at least at our hospital and oftentimes elsewhere, it's the CRNA who's managing your case in the room. So you've met oftentimes with an anesthesiologist in the pre-op, they've reviewed your file and tried to determine, the safety of the procedure for you, but when you are in that room, it's your CRNA. That's a type of nurse practitioner, essentially. It's an RN who's gone on to advanced anesthesia training. They are in super high demand nationally, just incredible high demand. We've welcomed quite a number. We've also lost a few. And then, because again, they can earn so much money as locums, right? They, rather than being under contract with one hospital, if their lifestyle is such that they are able to be, to travel, I mean, it's just an extraordinary opportunity for them. I don't want to deny them that, but it does put some real pressures on healthcare systems. The other tall bar is your hospitalists. Your hospitalists, I'm really proud of the team of hospitalists we have at the hospital. I've recruited quite a number of them. We've welcomed 14 over the last 3 years. Nationally, hospitalists are highly mobile. They don't have a patient panel. They come in, they work a shift, and they have the patients who happen to be on their service that are inpatients, but then those inpatients go on to their primary care providers. And so it just means that they're slightly less invested. Terrifically important, but I just want to point out what a success that we've been able to recruit this kind of variety into the community. By the way, this is the MultiCare brand central color scheme. So all of these colors here, the slide deck is MultiCare brand central, and I just want to, so you'll see some of these, the chartreuse yellows and the blues. I mean, that's on point. I want you to know you'll see more of that as we start to have billboards and such. You saw it here first. So special highlights in 2020 with our 27 providers. Well, we did have, we welcomed a pulmonary critical care physician, and we have an immigration attorney in the house. I think that you mentioned that. I cannot tell you how grateful I am for the partnership of the immigration attorneys that we work with. Tiffany Pirelli, she's part of Pirelli Renison in Portland, and I want to give her a shout out because we, in the federal statistics, are an underserved population, and as such, we're eligible to sponsor physicians who come to us on work visas. And it's really a tremendous opportunity for us. These physicians who have trained in their home countries and sometimes have even not only completed medical school, but also specialized training in their home countries. But the rules here in the United States are, it doesn't matter the level of academic achievement that you achieved in your home country. If you would like to be board certified, i.e. eligible for reimbursement in our country, you have to then start over at the residency level. So you're going and so oftentimes they have completed training, twice as much as your native born providers. So I just consider it a real honor to be able to bring in some of these physicians and shout out to the immigration attorneys. So let's see, moving on here in 2021, I previously mentioned that we brought over cardiology providers. One of the significant achievements in 2021 is that we were able to welcome 2 net new interventional cardiologists, and Josh had a chance to meet both of them at the aforementioned event at the Foundation House. So some really exceptionally well-trained individuals. We also, by the way, getting into here, we'll move on to 2022. We welcomed 2 OBGYNs in 2022, and that's not insignificant because OBs are notoriously hard to recruit. But one of the great relationships that we have, and I'll move on, I think, to strengths and challenges. So here we go. One of our strengths, right there. I don't mean to be Team Husky here all the time, but that is where the tuition dollars go right now. So we are a clinical rotation site for the University of Washington's OBGYN residency program, and they love us because we are very fertile in this valley, and our family birthplace is a very busy, we are still averaging 7 births a day, even as nationally, we are not having as many babies as we used to. We're busy on the 4th floor at the hospital, and the University of Washington residents really enjoy coming to us. And so we had the chance to hire Dr. Noah Qualls, one of the residents who graduated from the OB residency at UW in 2021. We had a second OB that we welcomed in 2022 who is a graduate of PNWU and a West Valley Ram, for any West Valley Rams in the house. So Dr. Kate Roberts came back after she completed residency in Chicago. So went to medical school here, went to residency in Chicago, came back. We also have our family medicine residency program here, right here, and yet we have 2 technically, one in the Lower Valley based out of Grandview, the Solis residency, but of course the Central Washington Family Medicine residency program. This is huge. So it's the Association of American Medical Colleges that estimate that within 10 years, 2033, the deficit, the shortage of physicians in this country will be somewhere between 54 and 139,000. I mean, it's significant. One of the reasons that we're struggling so is that residencies, so you go to medical school, so that's 4 years. You earn your MD or your DO. The next step is residency. You can't practice medicine with just a medical degree. You have to go on to residency. And as a resident, you're either a family medicine resident or you're an internal medicine resident. Doesn't matter, either way. It's really hard to get a residency spot. You would think that this would be like, you know, you've punched your ticket, you've got your medical degree, but au contraire, because since 1997, there has not been a significant increase in this country in the number of residency positions. They're federally funded disproportionately. So the primary source of funding for residency programs in this country is the Centers for Medicare and Medicaid. And again, there's just, just haven't seen it. One COVID relief bill has funding for about 1,000 more residency slots. And I mean, it's something, but when you consider the deficit that we think will be between 54 and 139,000 in 10 years' time, it's not quite enough. But we're lucky. I mean, we do have our family medicine residency program right here, and each class is about 12 residents, I would say, on average. And so we are fortunate to be able to keep some of those residents in our own community. We hired 2 in 2020, I think it was 2021, Dr. Alana Muir and Dr. Josh Johnson. I mentioned how it's wonderful that we have our eligibility for our foreign trained physicians. We do offer competitive compensation. I will definitely note that. It tends to be true that you can ill afford to offer anything less than the MGMA median when you're in an area like Yakima. We love it, it's wonderful, but trying to attract your providers. So they do earn a very fair salary coming to work here. If you come to Yakima as a provider, you will not lack for patients. We have patients aplenty. We can fill your panel as soon as you arrive. So I do try and sell providers on the fact that you will have an outsized impact on patient care if you choose us. You just will. I mean, we have lots of medical needs in this community, and we don't have the advantage of some of your large metropolitan areas with their large training programs, and we need every physician who comes here. And so we know it's a great place, outdoor recreation. I mean, I talk up that all the time. If I could convince more of our providers how much better their lives would be without traffic, I mean, we can all agree. Like, think about what you get back, right? And of course, our community, and I thrill at being the host for provider site visits for Memorial Hospital. I take candidates to the museum. John Ball's amazing. He makes himself available free of charge for personal, bespoke tours of the museum. Recently, Kat at the theater has offered up free tours of the theater. I mean, they're not getting this experience in other communities. So usually, I mean, I have a pretty decent success rate if I can get the providers here for a site visit to convince them that this is where they want to live and practice. Because this is, I think we can all agree, a great place to be. But our challenges, most often they've done a Google search. And if you've Google searched Yakima recently, oh my goodness, I don't know. It's so unfortunate. We can't shake it. And of course, we had the recent tragedy of the shooting of at the Circle K, and so and there's legitimate fear at times for some of these candidates. They just can't quite. And I'm not. Any thoughts? Ways that we might be able to, I'm all ears, because I can't think we're the only community where this might be the case. Our limited, anyone here with the air terminal in town, we need more flights. That's a real challenge for us. It does seem like the end of the earth a little bit when there's one flight a day and they're like, where are you again? So I have candidates flying into Pasco. I have candidates flying into Seattle this time of the year. That's dicey, especially if they're not familiar with the mountain range between here and there. And it would be nice to have more flights. It's a great job. There we go. Okay. I'll use that. Yes. One of the challenges was as a hospital system, you might have heard, we had some real challenges financially at Memorial. I'm not here to break that news, but I'm here to tell you, very true, very legitimate. One of the ways that will continue to be a challenge is of course, now we have MultiCare and we're grateful, is that we are about 75% of our patient base is a federal payer mix, so Medicare, Medicaid. And again, there's not really a positive margin on a lot of that care. I mean, it depends on the type of procedure, but it requires just near perfect administration to make that kind of a payer mix, that 70 to 75% with the kind of reimbursement that we get out of the Centers for Medicare and Medicaid. I mean, we've had our opportunities to do better. I mean, every organization does, but those limited financial resources are really impactful. So as we segue into the MultiCare portion of this presentation, we're really grateful. There's been a lot of disruptions within our medical community, and I think that we're not alone, but certainly when you think about my time as the provider recruiter, when I started, we were Virginia Mason Memorial. Remember that? We were an affiliate of Virginia Mason, the oldest hospital in Seattle. We were not owned, but we were affiliated, and so all of our marketing, our public image was attached to that. And then, of course, we unwound that affiliation, and then we were Yakima Valley Memorial, and now we're MultiCare Yakima Memorial, and it's a lot for your candidates to keep up with. We're dancing around. We're doing a lot. We had to adjust to life as a sole community provider, the sole community hospital, and there have been some pinch points. And then service line development. So because we found ourselves falling a little behind the curve on recruitment, vascular comes to mind. We will have to rebuild a vascular program. We don't currently have a vascular program in any meaningful sense at the hospital. We need to rebuild our gastro practice. And cardiology. Sadly, we've had a number of general cardiologists leave the organization over this last year. And so one of the special challenges when you find that you've fallen just a little behind the curve and you haven't replaced one for one, and now suddenly you're down 2 or you're down 3, if you're the remaining physician in that situation, suddenly instead of being on call every other week or every third week or every third day, now if the hospital is going to try and preserve that service line, you have no life, you're on call all the time, or we're paying for locums, and locums are really expensive. So that's one of those, that's where we find ourselves. I just figure honesty is the best policy. We've got service lines in some areas that need to be rebuilt. And so we don't need one, we need 2 or 3 physicians in that specialty to make a team and make every individual member of that team have a lifestyle that works for them. So guess who's here? MultiCare! And it's multi, not multi. So that was a big thing in the first. And then when you hear Tammy Bouyak and our president, she sometimes says multi. But I'm here to tell you, Brand Central says MultiCare, in case you were curious. Guess what the first part of Yakima Memorial, what was the very first part of Yakima Memorial to be integrated at the system level? And to date, the only part. Provider recruitment. Yes, they came in. In fact, a little birdie has told me that Bill Robertson, have any of you had a chance to go to any of the presentations that Bill Robertson, CEO at the system, Florence Chang, president, chief operating officer? Turns out that even before this was publicly announced, January 17th, the acquisition was official, they were already strategizing. How do we, on day one, integrate physician recruitment? Not for lack of effort on our part, but just a recognition that when you have such significant needs and when you are the safety net for we're a swath of the state of Washington, our favorite part of the state of Washington, I appreciate that they recognize that provider recruitment would be the way to start. So this, by the way, I completely copied and pasted from a MultiCare corporate provider recruitment strategy document. So not to say that we weren't doing some of this before, but the scale at which we are able to promote our opportunities, again, it's a very different animal, being now the 12th of a 12 hospital system. Whereas before, you're looking at the sole provider recruitment team for much of the last 3 years. So, I mean, I'm happy for the help. So again, these are all of the many places that the MultiCare team will and are currently promoting our positions. It goes on. I share this not so that you can read it, but rather so that you can feel grateful that we have now, as this MultiCare system acquired hospital, all of this wind at our back. So we've got Indeed sponsored jobs and Indeed ads and Glassdoor ads, and I'm not familiar. I have to admit, Next ads, that was new for me. I was not doing that. Practice Link, magazine ads, again, not only being in Practice Link, the single most important tool we have, but also, magazine ads. So again, that kind of additional spend is something that we're really excited about. Career fairs, they're not as important as just being on the internet. Email campaigns, it goes on. And of course, the employee referral program. So this, by the way, this is a team of 12 provider recruiters, all remote. Some of them just happened to live in Yakima, but the provider recruitment plan model at MultiCare is that you have 12, they're specialized by physician type, and then my hope and dream is that I will have candidates coming from each and every one of these individuals where we have openings, and then of course then I get to show them Yakima when we get to that point. So we went from me, and Kate Luce is another, and to 12 plus me. So that's what we have in the wake of the acquisition on the 17th of January.
Were the Yakima people already on the recruiting team, or those the Yakima people that were part of your team?
So there are two, so Mitch Engel and Sydney Mormon, who are on the bottom here, recently, as recent as just this last quarter, October, around about of 2022 is when we, pre-acquisition, were expanding the provider recruitment team. And so they did come straight from the team and now are part of, so rather than being in-house for every opening that Yakima has, they are part of a 12 recruiter team and assigned to specific specialties. I think I'm so sorry, I probably ran over. I don't know what time it is.
You're great.
Oh.
Time for questions.
Oh my gosh, I love a question. Okay, right here, Mr. Allen.
So, is the reimbursement rate for Medicare and Medicaid the same in Yakima as it is in, say, Seattle?
I should know the answer to that. I'm going to say no. Reimbursement rates are variable, and they're variable based on the type of hospital system, your designation. Every system has a designation within the CMS system. So for instance, if you are a critical access facility, your rate of reimbursement is higher because the government has identified that if you shut your doors, there will be a rural community with no access to health care. And they don't want that to happen. So as a critical access designee, like Kittitas Valley Hospital, for instance, KVH up in Ellensburg, their rate of reimbursement is higher than ours. I can't speak, so I guess it would depend on the facility in Seattle and what their designation is.
Yeah, one time I understood that when Medicare and Medicaid Medicare first came out, they went around the state and looked at the cost of living, and so it cost more to live in Seattle, so they got a higher rate than in Yakima. I just didn't know if that was significant or not, but I always thought Yakima takes second fiddle in the political arena, and we even had one of our own as the governor over there, but that hasn't been.
I think that, well, I can't speak for the whole area because, again, there are like your federally qualified health system farm workers. I'm not sure farm workers in the House, but again, their rate of reimbursement is higher for the care they provide than necessarily the hospitals. I mean, it's not apples for apples, it's different type. So there are some of us at the hospital with a little chip on our shoulder because we don't have as many advantages in terms of the reimbursement as others providing different types of care. But I can't speak to geographically or whether cost of living. My apologies. I will research and I will send the response to you, Josh, and Josh can send it out. I'll tell you, and I'll provide my source material. Okay.
What are we doing to grow our own?
Oh, so yes, let's talk about that. So certainly, PNWU, I mean, to the degree that we are able to attract providers, let's start with APPs, physician assistants and nurse practitioner. One of the challenges, we don't have local nurse practitioner program. And of course, the one PA program that we had locally at Heritage, they did lose their accreditation, and so they are no longer in existence. So one of the opportunities, I think, is this community is to develop either a PA or a nurse practitioner program here locally, because that is a gap for us currently. But certainly, I mean, PNWU is a wonderful and growing, and I look forward to the additional programs that they have. I mentioned, of course, the residency program. That Central Washington residency program is something that the hospital has helped to underwrite and subsidize for a number of years. Again, lots of funding from the government, but also some support locally. What else are we doing? We have medical students in the halls regularly. We are not considered necessarily an academic institution, but many of our physicians are really committed to being available because it can be hard to find the clinical rotations. Here you are trying to earn your physician assistant degree, and many programs do not come loaded with all of your clinical, your hands-on opportunity. I mean, arguably one of the more important parts of the program. So you're out hustling, trying to find an opportunity to spend time because these providers, many healthcare professionals are already spread a little thin and don't necessarily, get excited about the idea of having a student underfoot. But to the great, I think, credit of many of the providers at Memorial, they are, and even today, anecdotally, I don't know how many of you know Dr. Neil Barg, but longtime infectious disease physician, one of my favorite people. He was meeting with one of the deans out of the University of Washington medical program in Spokane, so that newer branch, and so trying to develop some connections and relationships for clinical rotations here in the Valley with those medical students. So I think that, as I say, all of our OBs are adjunct faculty at the University of Washington, and hence we get all of their OB residents. But what do you have ideas on that?
Well, since Wazoo has a program at YBC, I would think there's a little pressure on Wazoo PA system there since they already have facilities. That's one.
Yeah.
Number two, you have some advanced placement kids at the high school level that are still making up their mind, and they've proven their doctorate so they can get their doctorate.
Mm-hmm.
They'll say, folks, we are short, and they already live here, and a lot of them like to stay here. A lot of them like to go away for a little while, but they realize, like Dirk over there, that this is much better living on this side of the mountain.
Are you saying that we in provider recruitment at the hospital level should be spending more time with our students in the community and encouraging this career path? And
One day a year to tell them that.
sign me up. Yeah. Your point's very well taken. I don't know, I mean, what, I'm not the only one who can do this, but I'm happy to go. I mean, I do have a heart for education.
So COVID seemed to show us that different states became negative and became positive as far as migration. Is Washington viewed as kind of a neutral state, and can we use it, if it's a neutral?
In terms of like COVID policies or?
No, not so much COVID, but like people moving
Yeah.
out of state.
Uh-huh.
And with California, huge state,
Yeah.
lots of docks.
Yeah.
Can we, their loss, can that be our gain? Can we recruit in in states like California, and Illinois, and New York? Or do we have to fight against Texas and Florida and Nevada, which brought people in? Does that make sense?
It does make sense. I think, the first thing that comes to mind, of course, we do not have a state income tax. And that is huge for your providers. So, not a bad strategy to do targeted marketing in areas where they have a significant state income tax, because I will tell you that many of the current attending, so after you've graduated from medical school and you've completed your residency and you've gone on to fellowship or not, you don't have to go to fellowship. Once you're an attending and you've started to earn income, many of the attendings who seek positions here have done their homework and are glad that we don't have a state income tax. So that continues to be a really important part of attracting folks to Washington. I don't know that COVID per se, I haven't seen COVID, I don't know, I feel like that's kind of a net neutral. I don't think that we were a huge destination, like, as you point out, some of the spots in the Southwest were for.
Idaho.
Yeah.
Everybody went to Idaho, and everybody, kind of fled. Because I don't feel like Washington. It seemed like it was a wash.
I feel like it was a wash too, yeah. I will say that one of the challenges for retaining physicians during COVID, it wasn't so much any kind of, state or regulatory policy or masks, no masks, fast. It wasn't, it was the pressures that it put on staffing, and especially nurse staffing. So at the hospital, for example, we were so understandably desperate to keep to meet our obligation to the number of patients coming into the hospital, that you had nurses, for example, that were out and specialized in outpatient clinics being called upon to come and shore up the inpatient side. And it did create, disruptions in certain programs on the outpatient side, just very specific to Yakima. But so that's probably been the most lasting effect in terms of some of the departures that we did see during COVID. Again, it was more staffing than it was anything else. But I appreciate the thought of what's our angle to attract I grew up in California, full disclosure. Attract yeah.
Thank you.
Any other questions? It's time to call it a wrap?
Yep.
All right.
Thank you. Thank you, Kelliann. As a token of our gratitude, we have a water bottle with Southwest Rotary. So thank you for coming and visiting today. Hopefully, maybe you can utilize Southwest Rotary as a recruitment tool for getting more people to the valley. So, yep. Okay. Yeah. She'll be here a little bit afterwards if you want.
Yeah.
And then let's see here, Mary Lynn, thank you, and Joe for your greeting. Frank for your Sergeant of Arms, Kelliann for our speaker. And with that, our meeting's adjourned.